In 1998, Minnesota spent $16 billion on healthcare, and family premiums for health insurance were about $5,000 per year. Nearly 20 years later, overall spending tripled, and families are now spending over $19,000 a year on premiums, and the state is spending over $50 billion. Take a look at this chart, because it illustrates the real pain of our current path. More and more of the dollars available in our state, and our personal budgets, are getting eaten up by healthcare, and it keeps growing faster than everything else, without regard for other prices, like housing and transportation. You personally may have felt this trend, like a rubber band that's getting harder to stretch. Maybe you feel it in your increasing deductibles or monthly premiums. It seems like your policy is covering less for the same price. Or maybe you feel it in the way added expenses are gobbling any raises or bonuses you might have landed in the past. And with all the dollars we're putting towards healthcare, everyone in our state still can't afford it. But it's not as if a lot of smart people haven't been trying to innovate. In the last 40 years, we've attempted all sorts of things. With managed care in the 80s and 90s, patients didn't like how their choices of which doctor to see and when was limited, and they pushed back. Health plan spending limits. They were pulled back because it didn't seem to constrain spending. Our first attempt at electronic medical records just didn't reduce costs as much as we'd hoped. Improved access to quality and cost information? It does not yet seem to drive substantive changes. Here are some of the factors we know can push us over the edge. Healthcare prices rise faster than our economy grows. New technologies in healthcare more often increase cost rather than save money. Administrative costs really add up. More of us, at all ages, develop chronic diseases. Many of us live in places that make it hard to be healthy. There are lots of mergers in the healthcare industry, meaning there's less competition to help reduce prices. And that's just some of them. There's no one factor that is causing healthcare spending to grow like this. Of course, we can just let healthcare spending continue to grow. By 2027, we'd be looking at spending nearly $98 billion on healthcare in our state, with family premiums reaching $35,000 per family. We'll be spending $34 billion on hospitals, and spending on Medicare and Medicaid will be more than twice as high as it is now, $46 billion. Of course, we could all get together and try to get these costs under control now. With so many different things impacting spending, it won't be simple. For starters, we'll need to understand we need more than one solution because there isn't a silver bullet. Start investing in what keeps us healthy, including public health and social supports, not just what tries to fix us when we're broken. Make sure the changes we do make are backed up with good data about what actually reduced costs. Be serious about trying out new ideas, even if they create winners and losers. Most of us probably don't expect to be making twice as much money in 10 years as we are today. And if our incomes and state budgets can't keep up with growing healthcare costs, what are we going to be missing out on? How far can that rubber band stretch before it breaks?